Hey, thank you, Dr. Dubé. Now it's my pleasure to introduce our keynote speaker, Dr. Posner. Dr. Posner is a distinguished anesthesiologist and former health minister of Aruba, renowned for his significant contributions to both the medical field and public health administration. He is also a member of the Xavier University Aruba Board of Trustees. As an anesthesiologist for more than 44 years, Dr. Posner has demonstrated exceptional skill and dedication in ensuring the safety and well-being of his patients. In addition to his clinical expertise, Dr. Posner has played a pivotal role in shaping health policy and governance in Aruba. Serving as the health minister, he brought forth innovative initiatives to enhance the overall health infrastructure and address public health challenges. His visionary leadership has left a lasting impact on the healthcare landscape of Aruba. For his outstanding career, Dr. Posner was the recipient of the Officer of the Dutch Order of Orange Nassau decoration. With a wealth of experience and a proven track record, Dr. Posner stands as a distinguished professional who has significantly influenced both the medical and administrative aspects of healthcare in Aruba. It is my honor to introduce Dr. Posner.
Good morning. It used to be when you wake up at night sweating, could be tuberculosis. Now it's exams. I love that. They asked me to give a white coat speech, and I immediately agreed because I have a saying: be nice to your young fellow doctors because they're going to be taking care of us in the future. Esteemed guests, respected faculty, and my fellow soon-to-be healthcare professionals. As I said, I was asked to give a white coat speech and immediately said yes. And as I told you, my motto is to treat your young colleagues well because they will be your future nurses and doctors and veterinaries. Today, as you begin a remarkable journey, I'm reminded of my beginnings and the valuable lessons I learned from those who guided me. Sometimes I cry when I do this speech. It's a story about acquiring skills and understanding the heart of healthcare. It's about people like Nurse Bryson, who with humor and wisdom taught me that even in the most critical moments, our human touch can make a difference. Like the time when my first injection brought Mr. Brown back from a coma. A startling but enlightening experience. I was 16 then, and I would spend most of my vacations working at the local hospital. Nurse Bryson would take me under her wing and teach me the ropes of the hospital. Mr. Brown had been in a coma for a couple of weeks and needed his daily injection. She explained how to give the injection and said I could practice on Mr. Brown since he would not be bothered by the injection. You can imagine my scare when I injected him, and in a deafening groan, he woke up from a coma. It must have been painful. In another occasion, Dr. Hage, the director of the hospital, once called me into his office because he wanted to know why the family of a patient was sleeping in the morning when the patient had passed away. Dr. Hage could hardly hide his laughter when I told them that since I thought the patient was going to pass away, I decided to give everybody Valium, a tranquilizer, so that they would not make a scene and wake up all the other patients. I was 16. But this may have been the first sign I was going to be an anesthesiologist. In the Netherlands, Nurse Nelly, and that's really her name, was my silent mentor in the intensive care unit. She whispered a guiding light through my uncertainties. And thank God, she also corrected my spelling in Dutch. You could know when I was on call because all the notes were in red, all the corrections she did. And then Nurse Avril in Aruba, an expert in empathy, whose intuitive connection with patients like, for instance, Sarah, a young woman crippled by anxiety, taught me the true meaning of care. She had the patient to sit down and talk to the patient and letting her to place an intravenous before nobody could do that because she would run away. Through these people, the essence of healthcare revealed itself to me in these moments. Today, as you stand ready to embrace your future in healthcare, I urge you to think beyond the white coats, the stethoscopes, and the technology marvels that await you, and all the exams you're going to have to do. These are important, but they are not the core of our profession. At our core, we are the bridge between science and the human spirit. Our healthcare system currently places a higher emphasis on business interest than on the well-being of patients. We must embark in a transformational journey to reorient our system, making the welfare of patients the foremost priority. This shift is not just a matter of policy. It requires a deep sense of empathy, a capacity to comprehend and share the emotions of others. Empathy bridges healthcare providers, administrators, and policymakers to patients' real-life experiences and needs. Truly put patients first. We must foster a culture of empathy within the healthcare ecosystem. Healthcare professionals, from doctors to nurses, need to cultivate a genuine understanding of their patients' physical and emotional needs. Likewise, healthcare institutions and policymakers must consider the human aspect of healthcare delivery, healthcare delivery, ensuring that decisions and policies are driven by compassion and a sincere commitment to enhancing patient outcome. In doing so, we can bridge the gap between business interest and patient care, creating a healthcare system that truly serves the needs of those that we intend to help. Imagine a patient, their life upended by illness, sitting in a room filled with uncertainty. As healthcare providers, we step in with our medical expertise and empathy. We listen, understand, and we connect. This language speaks to the soul, transcending diagnosis and recognizing the person beneath the illness. Research has repeatedly shown empathy profound impact on patient outcome. It leads to better compliance, reduced anxiety, and enhanced well-being. Empathy is not optional. It is essential. It is what completes the circle of healing. Compassion, the action born of empathy, drives us to go further, to be present, attentive, and emotionally available, especially when our patients are most vulnerable. In your journey through healthcare education and beyond, do not let empathy and compassion be mere words in a textbook. seek them out, cultivate them, immerse yourself in diverse experiences, engage with different communities, and delve into humanities. These are not just extracurricular activities, but vital to your education. Remember, our institutions have a role to play in nurturing these qualities. We must select and value individuals, not just for their academic prowess, but for their human qualities. Technology, including AI, can aid us, freeing us to spend more time where it matters most, with our patients. As we shape the future of healthcare, let us anchor ourselves in empathy and compassion. These principles can transform healthcare into a force for healing, hope, and well-being. Your time here in Aruba is just the beginning. Embrace the friends and the memories you have made and carry them forward as you embark in a noble path. Thank you. Let's move forward with our hearts leading the way, transforming healthcare into a journey of human connection and healing.